Namaste, good evening, everyone. It's me, Kalu Singh Karki from Health Insurance Board, work as a senior IT officer. I'm grateful that I have a chance to share experience of using OpenIMS in Health Insurance Board. A feature of Health Insurance program, the Health Insurance program is a family-based contributed program. Different target groups are categorized by Government of Nepal. That is SIB, MDR-TP, leprosy, elder above 70 years, senior citizen, and a profound disability, and ultra-poor family are subsidized by Government of Nepal. The OpenM is being used to manage all core process of Health Insurance Board. The purchase provider split pair are kept organizational separate from service provider. Public as well as private health facilities are impaneled as a service provider, which are contracted as a health with a health insurance board. The feature of health insurance program is a contribution based program. The contribution amount is Nepali rupees 3,500 Nepali rupees and 35 US dollar per family up to 5 members. The family unit is defined according to law of Health Insurance Act. And additional people is added premium Nepali rupees 700 7 USD for every additional family member, and 100% subsidy of families ultra poor SIB target group that are included in marginal group, and 100% subsidy elder population above 70 years, which are called senior citizens. The benefit package of these contributed and enrolled insurance have a formative, preventive, and curative services, outpatient, inpatient, and emergency care. A benefit sharing start from 1 lakh Nepali rupees to 1,000 US dollar per year per family up to 5 member, with an extra 20,000 and 200 US dollar encourages each additional member up to 2 lakh in Nepal rupees, and approximately 20,000 2,000 US dollars, and additional 1,000 and 100 US dollar for each elder population, which is defined single member at a single unit, which is called senior citizen. The current status of health insurance program is total enrolled population are 7.7 millions, which are 26.5% of population of Nepal, and active insurance are 4.9 millions, and total family are enrolled in 2.3 millions. The percentage of household according to census of Nepal 42.45, and subscription rate of health insurance was 46.2%, and 7.5 millions of people for 51.49% of female are enrolled, and female are more than male people are enrolled in a health insurance program, and 442 health facilities are participating, which are contracted with the Health Insurance Board of Nepal. The open image implementation overview in Health Insurance Board is the open image do for SIB is different areas. The open image support the management of core business process at SIB, which are enrolled process, ability of Android-based app for enrollment. Enrollment has made that enrollment assistant can go door to door, bring household into the scheme. A web-based claim entry and app adjustification module significantly diminishes paper-based transaction and reduce paperwork for health facilities. This has enabled the Health Insurance Board to achieve the current rapid rate of expansions. And the data analysis of concept with the Health Insurance Board of Nepal Central Office analyze the different data with annual programming. Who uses in OpenIMS in Nepal? The above 7,000 enrollment assistants which are worked at a world level in different overall Nepal, using their mobile app to register families, and 442 health facility using the software to verify injury and manage claim, and 161 enrollment officers from different district usage open to entry, update, injury detail and families, and update premium also. And 26 claim reviewers are review claim at a central office. We are getting on an average of 50,000 claims daily, and 5 dedicated IT personnel are working on health board as a head office. The overall workflow for claim processing is this workflow. So the health facilities verifies membership and policy details through the oponymies, and how the claim is submitted and adjudicated using oponymies. Reimbursement is done when the claim is verified based on relevant documents submitted through the system, which is processes by oponymies. The oponymies expense in SIB is a use of oponymies enabled quick implementation of MIs for health insurance in Nepal, continued support from oponymies community of practice enabled learning sharing between different countries context, regular availability of new version of software with frequently updated, ability of country level capacitated human resources to manage and maintain software as required. The integration and interoperability of IMIS is as seen on the picture. OpenIMIS is a core software to manage all functions of the health insurance program. We have added Fire API, which has enabled health facilities to submit claim easily. We have also developed a mediator, which acts as a bridge between different payment gateways, other government services, and OpenIMS, which is shown as a picture. The other initiation from SIB, SIB profile app launched by Health Insurance Board. Health Insurance Board. Previously, OpenIMS did not have any functional where an insurer can see his or her details about insurance policy, claim, impaneled service provider, service covered by health insurance, and notification of health insurance related. SIB developed mobile app with help from GIZ Nepal. With the help of SIB profile app, insurance can also show virtual card during verification at health facility, stay informed and take their decision. And as of today, 10,000 plus insurance has already downloaded this app. And we are continuously upgrade the app to add new feature and functionality, which helped insurance to access their information on their hand. Online renew. Health Insurance Board also initiate the online renew. Online is another functionality which launched last year, 2022, maybe 2022. Insurance can renew their insurance policy online using different mobile wallet and payment gateways. As of now, 11,000 plus families have renewed their policy online using online gateway portals. The other system developed by HIB is other system developed by HIB are also interoperable with OpenMIS. For example, e-service enrollment app and claim doc management. The e-service system was primarily used to reprint lost, damaged insurance cards. New features were added in this system later, which complement day-to-day operation of SIB. The new enrollment app was developed. Some of new features such as uploading of receipt detail, calculating premium amount as was incorporated in the app. we are planning to add additional new feature based on suggestion from the user. The user are enrollment assistant, which are worked on ground level in a ward level. In claim management, the claim document management system developed to manage claim related document that needs to attach during claim submission. Based on attached document, claim reviewer review the claim and make decision accordingly. This has increased the efficiency of claim selection. A new initiation is also online enrollment. Which help citizen can register online in the health insurance program, primarily linked to national ID card verification on process. It is a process under processing process. Hope it will start maybe next month. All Nepali citizen which are not enrolled in health insurance program before, they can easily enroll the insurance through online registration, and the facility to payment through the mobile wallet. Thank you. If any query, yes.
Thank you, Sir Kalu. So now we'll proceed to the presentation of Dr. Roshan from SSF.
Good evening from Nepal, and probably it's a good evening to all, actually. So I would like to thank AeHIN and OpenMS community for this opportunity. I'm going to share my presentation on use case of OpenMS specific to the Social Security Fund. This presentation may be a bit technical. If it is so, if it happens to be so, I'm quite sorry about that. But I will try to put this presentation as much informal as possible and try to elaborate the things that what we have done and what we have been doing with OpenMS in SSF in much simpler words as far as possible. This is what I'm going to discuss today. I'll be discussing about SSF in brief, and I'll also be discussing about journey of SSF with OpenMS. The working model somehow it's much more similar with that of the HIB that we have just was the presentation from Mr. Kalu. And I will be discussing some unique features that we have implemented so far with OpenMS in OpenMS. And I would also like to discuss some of the upcoming features that we are planning and we are working with OpenMS right now. So let's begin with the discussion of brief introduction of Social Security Fund OpenMS. Social Security Fund is actually one of the youngest government organized in Nepal, which guarantees the minimum regular income of its contributor in every hard situation from the birth and to the even after the death. So we will be paying certain amount of Social Security amount to every contributors in their every hard situation, whether it be their any sort of sickness leave or any sort of hard situation. We have been implementing 8 out of 9 social security programs or social protection programs provisioned by ILO in their ILO Convention 102. One of the social security program that we have not implemented so far is unemployment benefit, but it has also been addressed in some other way rather than what it has been discussed in Convention 102. We have been using OpenMS for especially the medical, maternity, accident, and critical illness benefits. To brief our scheme, we have been providing almost 100,000 rupees for medical and maternity claim benefit. And this is co-payment basis. This is the co-payment scheme. Similarly, we do have some benefits regarding the accident, where we cover unlimited amounts of benefits, provide unlimited amount of benefits. We also provide a critical illness benefit up to 1 million for each contributor. SSF was established some few years ago, almost about 10 years ago. Till 2 years ago, we had been working on for formal sector workers only. But from 2 years now, we have expanded our schemes, our coverage to informal, migrant, as well as all sorts of self-employed workers. So SSF is, or Social Security Fund, is working for social security of all sorts of workers throughout the country right now. The journey of OpenEMIS in SSF is quite new. It's not so old. We have started implementing OpenEMIS from 2021 actually. Back then, we have not implemented online claims, but people used to claim manually. They had to pay their medical bills from their pocket, and with all the bills and all the attachments, they had to visit our office. Till back then, we had only one office at the capital city of Kathmandu, capital city of country, and they have to visit with all documents, and they will be reimbursed based on their payment with reference to our reference payment slip, right? So this process was upgraded to the completely automated process with the help of GIZ. It was to 2022. From there now, every medical claim, every accident claim, and every critical claims have now been completely automated, and neither of physical documents have to be submitted here in office, nor any patient have to visit. So now, so far, we have 80 plus impanel hospitals who have been providing this online claim, who have been managing these online claims. Those hospitals includes some private, some of them are public, some of them are teaching hospitals, and even some pathology labs have been implementing this online claim management system. Since we are very young, we have been receiving almost around 1,000 plus claims per day. This is, I forgot to mention, per day claims here. So OpenEMIS is not the single application that we have been using. There are lots of applications. Out of them, OpenEMIS is application to manage claim in our system. So first of all, I would like to introduce one more application here. The right corner application with the umbrella and 4 peoples is our core business system. We call it SOSIS. The center one is the OpenEMIS icon, as you know. And for the rest of the business, we use SOSIS. SOSIS is our Social Security Information Management System, where every people gets registered. They contribute their contribution deposited with the help of SOSIS, and it's sort of ERP. We do have records of investment, we do have records of inventory, we do have records of collections, we have records of KYC. Everything is first managed by the SOSIS. So the OpenEMIS works in between the SOSIS and end users like hospitals. First of all, OpenEMIS shares the details of beneficiaries. Here, the beneficiaries are the contributors. With the help of those details, then hospital can check the eligibility of any patient or any contributors. If the patient is eligible for any source of medical accident or critical illness, then they can upload claims along with the items, services, and supporting documents, right? Then after, those claims are reviewed by our review team in OpenEMIS, and if they are valid, they will be evaluated for and proceed for the payment to the SOSIS. Once SOSIS receive the evaluated claims from the review team, then it will pay the claimant directly to the bank and directly to the hospital to its bank account. At the meantime, hospital can regularly check the reports or view the reports of their claim and payment status. Generally, claim can be in interstate, or it can be review state, or it can be evaluated state, as well as can claim as once the claim is evaluated, it can be in payment state, paid state, or payment initiated state, like that. So this is general working model of OpenEMIS and other system associated other systems in Social Security Fund. Now, I would like to discuss some of the features that we have developed on our own for our specific use cases. The first thing is the booking. Before discussing about the booking, I would like to introduce the problem that we had faced first. So problem was actually like, we had started to provide the benefits for the dependents as well. as I had discussed earlier, we have a scheme called medical and maternity schemes, where the contributors, if they are eligible, they can have the benefits of about 100,000 rupees per year, which is actually co-payment basis. But this scheme has been extended to its dependents as well. So whether his or her spouse is contributor of SSF or not, because of the contribution of the contributor, his or her spouse will also get the benefit of this medical benefits of Social Security Fund. But with expansion of these benefits, there we got a problem that these two spouses, the couple can be geographically located in different locations. So when they visit the hospitals or health facility providers, we can have the problem of balance deduction, there are available ceiling deduction problem. And not only that, even one of the hospitals where the first contributor visited, due to any reasons, failed to claim on time, and even the same contributor visit another hospital and that next hospital claims earlier than the old previous hospital, then there can be problem that older hospital or the first hospital where the contributor has visited may not be provided the claim because of the ceiling amount that has been provided to contributor may be deducted due to the claim of the second hospital. So this problem has to be addressed, and we had faced a similar problem in past. So for that, we have introduced the booking solution, where every claim, before even it is made the real claim, we start booking each claim. For that, we provisioned a new term called available balance. This available balance will be actually the gap in between real balance and book balance. So book balance is everything that contributor asks for or medical person or physician have prescribed for. So whenever he visits the pharmacy or whenever he visits the lab, there he will have to pay certain amounts of bill for that particular service or particular items. Before the hospital makes any claim, real claim, those amounts will be booked and those amounts will be reflected in Social Security Fund as a booked amount. So this available balance may be the book amount may be equals to the claim amount, or may be adjusted due to the returning of the items or returning of the not availability of the services. So available balance will be adjusted after claim is evaluated actually. So this is one of the feature that is implemented in SSF, and it has reduced lots of pain actually. Similarly, we do have some features to control the duplicate claim. The problem is actually health facility provider can know the upper ceiling or available ceiling amount of contributors if they know the contributor ID. They can just hit and trial. As you have seen here in this flow, hospital can check the eligibility of a particular contributor. While checking that eligibility, they can find the amount available, balance available of that particular contributor. So we have faced some of the mischievous activity from the hospitals, that if the contributor has left some of the balance at the end of the fiscal year or at any period of time, then hospital have done some of the mischievous activity by claiming the old claim, submitting the old claim, pushing the old claim on behalf of the contributor, which was not a real claim actually. So to avoid this situation, we introduced a duplicate claim control mechanism, where we have used the hospital claim ID as well as SSF claim ID together to form a new claim ID. The unique ID determines if this claim ID is unique, then the claim is not duplicate. We provision in that way. And if the hospital claim ID is repeated, or if they have repushed the old claim, then it is termed as duplicate claim. So we were able to filter out duplicate claims in this way. But this feature is only applicable for the hospitals who have been using their own legacy application. And we have integrated our system with hospitals to the FHIR, as HIB has been using. But there are some of the hospitals who doesn't have their own applications, legacy applications. So they have been using OpenEMIS. So for the OpenEMIS, the above mentioned application is this solution was not working. So that's why we have introduced some sort of vault provision vault in our system, where we compare hospital ID, SSID, means contributor ID, and visit date. We bundle up all those three things together to form a one new ID. And if all these three things combined together give the one ID, and if it is repeated again, then we term it as suspicious activity and post in the vault. Then our medical person review the claims in the vault to determine whether it's actually a duplicate or not. And if it is not duplicate, then it will push forward, it is forwarded to the review team. Otherwise, it will be rejected from the vault. The fourth feature here in our OpenEMIS is the claims of newborn. The problem is actually we do have a situation we do have a benefit like every new parents can claim for the newborn after the 3 months for medical in case of medical benefit schemes. But the problem is the newborn child won't have its name, so thus the parents can update the KYC in our system. So it's very difficult for us to claim or parents to claim on behalf of their newborn child. The main problem we observed was actually when the service is not available in the particular hospital and they have to transfer that newborn child to the another hospital, then there was a real problem in our case. So to address this situation, we introduced some prefix like I, J, K or something like that in front of contributor ID to identify the newborn. So they can be three triplet newborn or any numbers of newborns. Then we will be prefix their we will give their ID as I followed by the contributor ID, J followed by contributor ID, K followed by contributor ID, with their default age 0. So the name of the newborn will be the name as the name of the contributor, but the age will be the 0, and it will be considered as newborn in our system. So every balances or every benefits ceiling will be deducted from the contributor's billing. So this has also been implemented in our system, and this is we understand this as a unique feature that has been practiced in OpenEMIS. Another thing is that because of some mistakes or sometime the health facility provider may be not submitting document they want to submit or they need to submit, or sometime our claim review team may need to ask some additional document while reviewing the claim. So in all system we had not this feature to reattach the document, but for now we have made some changes in our OpenEMIS system that we have provision of flag for requesting for attachment of additional document from either side, whether from the reviewer side or from the health facility side, health facility provider side. Once the flag is raised, health facility provider can upload missing document or asked document from the reviewer side. And once it has been uploaded, the flag will be closed. This process can be repeated numbers of times. And we do have a problem also of fiscal year dilemma as well. The problem is that every ceiling of the contributors, that 100,000 rupees of medical benefits and unlimited benefits of in accident scheme and 1 million benefits in critical illness, these schemes are actually renewed in every new fiscal year. So at the end of the old fiscal year, there may be the list of files for the claim files for the processing or reviewing. But these old claims need to be deducted from the old amount or old available balance. But since new fiscal year has introduced new balances, there had been always confusion that how to manage all those old claims from the old benefits. So for this problem, we also introduced a solution like we tied up a bundle of the policy ID for every schemes. Every contributor need to have some sorts of ID called policy ID, and this policy ID are tied up with the claim ID, and this forms some sort of unique ID again. Every policy ID carries some sort of data like contributor ID, the validity duration of that policy ID, and available balance as well. So for old claims, now will be flushed with the old balance with the old policy ID, and new claims will be flushed with the new policy ID. In this way, we also solve this problem as well. And this is we guess this is also the unique solution that we have been practicing with OpenEMIS. And for information, we have been also using accident and critical illness benefit in our OpenEMIS. There has been we have been using ICD code, ICD 11 and ICD 10 both in our system. And for that, we can easily distinguish the type of the claims, accident, medical, and critical illness we have managed in that way in our system. So these claims can also be processed, uploaded from the hospital directly without visiting here in our offices. So these are the things that we have implemented so far, and we guess these are the unique features that can also be used by other implementer of OpenEMIS if they are in need of these features actually. Now, I would like to discuss some of the upcoming features that we are working right now with OpenEMIS. We are working with some reclaim activities. We are also working with some non-medical claims. So far, we have discussed are for the medical claims only. We do have some of the benefits like non-medical claim benefits as well. So we are also trying to implement those non-medical claims in our OpenEMIS as well. We are trying to extend our medical scheme to the family. So our OpenEMIS is to be modified to support the family benefits as well. We are also working on modifying the OpenEMIS. Sorry, it became hard to support multiple EHR, EMR, HMIS software to make a claim, a single claim. The problem is actually single hospital can have multiple softwares working in that particular hospital. So while working with multiple hospitals, they are facing the problem of lodging a claim, single claim with multiple software. So we are also working with for that as well, particular problem as well. And in addition, we are also expanding the features of we are expanding the features by adding new functionalities in OpenEMIS to make it more like ERP as well. So these are the things that I would like to say with this meeting. And thank you for your attention. And if there are any queries, I would love to answer. Thank you.
Thank you for that presentation, Dr. Roshan. So now we'll proceed to the last presentation for tonight, which will be presented by Sir Purushottam.
Yes, thank you, sir. Thank you, Dr. Roshan and Kalu for presenting on the status of OpenEMIS for HIV and SSF. I will be talking more in details about how OpenEMIS is being used here in Nepal, and then some global perspective as well, and some data standards things as well. Before that, so GIZ support to health sector strategy. This is German development support to the Ministry of Health. And we are implementing this project from July 2021 to June 2024. And we have been supporting Ministry, Government of Nepal in 4 different topics. So one, social health protection. Second is subnational health management. Third, integrated health information system. And then fourth, reproductive health. Under these 2 topics, social health protection and integrated health information system, we are supporting directly to HIV, Health Insurance Board, and Social Security Fund to improve their core processes and then improve digital data and information interoperability. So as already shared by Suresh and Kalu and Dr. Roshan, OpenEMIS is a modular system which is customizable, and then OpenEMIS has a different way of doing things. So as Roshan sir mentioned, they are using OpenEMIS to manage the claims, whereas Health Insurance Board is using OpenEMIS to manage all their core processes. So each implementer can choose different modules to implement based on their needs as well. Moving on, So when Kalu shared the workflow of their system, he highlighted how OpenEMIS is used to manage the health insurance claim. In OpenEMIS, there is a fire interoperability, the standard that is used by different healthcare service providers throughout the world. OpenEMIS is being used in both SSF and HIB to exchange the data between electronic healthcare system and insurance system. Uh, and then, but while we were trying to use this FIDE standard throughout Nepal, there was a quick issue on how we could approach this FIDE implementation, how quick we could expand the FIDE implementation throughout the country. The traditional approach that we saw was we have to invite some health facilities, and then we sensitize them about what is interoperability, what is data standards, and what fire is, and so on. And then the health facilities should then inform the software vendors to, with the limited information that there is a standard called fire, then OpenEMIS is using that, HIB is using that, and then how we could implement that with our system. And then the vendor will then again ask the implementers that what are the details, right? So with this traditional approach, we see that this repeated tasks and delay implementation was there. And with the help of HIB and SSF, we thought of a new approach there. We invited software vendors. Because there are some limited number of software vendors who develop EHR and EMR system throughout the country. We sensitized those software vendors about the interoperability, about data standards, and about FHIR. With this approach, the FHIR knowledge dissemination was quick, and then the implementation was also easier. And as you know, OpenEMIS has these four core functionalities, modules, beneficiary management, the health service utilization, claim management, and scheme definition. OpenEMIS is interoperable with DHIS2. We can export data from OpenEMIS to DHIS2 and do some other data analysis there. The hospital reimbursement contribution collection can be done with the banking and payment system as well. And as Roshan sir has mentioned, the beneficiary system can be interconnected to OpenEMIS to manage the beneficiaries, to sync the employer and employee data between two different systems. And EHR, EMR system can again send data to OpenEMIS, and OpenEMIS can send the data to EHR, EMR system as well. So these are the interoperability standards that OpenEMIS uses. So there's already one existing standard called OpenHIE, which has a framework which defines what are the layers of interoperability, what are the systems that could connect to each other. And these three are the new standards that these are emerging in the market. So one is the digital conversion. So this is a social protection initiative, and they have defined a set of standards for data exchange with CRBS system and other system. And there is a payment layer called OpenG2P, which will be again interoperable with OpenEMIS in the near future. As of today, as of now, there are some countries using OpenEMIS here. So there are 11 implementation for health financing, and then 5 implementation for social health protection. There are new countries coming in to implement OpenEMIS in the health insurance scheme or social protection scheme. And then with the help, there is a standard and interoperability lab that that Ministry of Health is trying to initiate. So this is an initiative from Ministry of Health which focus on interoperability of digital health application. So this lab is a collaborative space equipped with digital health experts to facilitate and design, development, and testing of various healthcare systems based on standards and interoperability. So a quick shout out. So there will be new version of OpenEMIS called April 2024 release coming in few days. So that's all from my side. Thank you.
Thank you, Sir Purushottam. We can now entertain some questions from our participants. I think some of them have already been addressed in the chat box. So as of now, we have one question that hasn't been addressed. It reads, thank you for the nice presentation. For the second presentation, how does data communication and exchange between the HIB and SSF function? And what protocols are in place for data exchange with the national ID system? Additionally, how are users informed about their usage claims and service utilization records?
So actually, this question, I had gone through this question, but quite confused with the question. What he was trying to ask is actually, so are you asking the intercommunication in between HIB and SSF?
The data
Or-
exchange between HIB and SSF. Is there any way? My concern was on duplicate claim.
No,
Can the
actually,
person has the HIB as well as SSF fund and they claim it from both?
yeah. So actually, HIB and SSF are working in silos. They don't have any link in between them. So there is policy gap actually in this matter. HIB each working under some different ministry, and SSF each working on a different ministry. We do have different working policy as well as different, everything is different. So we don't have similar common scope of work actually. So we don't share any information right now, as of now. Probably.
Thank you. So
there can be.
Yeah, first question was on that regard. If it could have been communicated with national ID system, it would have been more rational. Thank you.
Yeah, thank you, Sir Biraj and Dr. Roshan. Are there any more questions from the floor?
I have one for GIZ.
Yes, please go ahead, Sir Biraj.
Is there a national standardization guideline for various software used in Nepal concerning like GIZ's funding aimed for digitalization is in Nepal's health sector, right? So I was just concerned about, is there any standard guideline, what sort of primary things that hospitals should use?
As of now, it's not there, but Minister of Health, together with the Standard and Interoperability Lab, they are trying to finalize the national guideline where each health system should follow. So there will be something in the near future.
Thank you. I think that is the last question. So thank you again, Sir Purushottam, Sir Kalu, and Dr. Roshan for sharing the implementation of OpenMS and Nepal, and also to our participants for making the time to join tonight's session, and our OpenMS and GIZ colleagues for their support in tonight's webinar. Please join us again in our next OpenMS webinars, especially in the next one about Lao PDR's experiences, which will be presented on May 22. We'll keep you posted and we hope to see you then. Thank you again, everyone.